Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. I'm your host, Dr. Jason Jones, your voice that is practical in a world of confusing health information. Now, we're going to continue our series on pain, and like I promised you last week when we talked about opioids, we're going to talk about today what's wrong with opioids, because opioids have been around for years. After pharmaceutical companies pushed them out to doctors as effective painkillers. The term opioid includes compounds extracted naturally from the poppy seed, as well as synthetic compounds that are built in a lab that essentially work the same way. Now, some popular medications are classified as opioids include things like oxycodone, hydrocodone, commonly known as Vicodin, codeine, morphine, and hydrocodone products, are commonly prescribed opioids that are often used to treat pain from injuries and dental work. Codeine is often used to treat a more milder pain, but generally opioids are used to treat everything from post-surgical pain to osteoarthritis. However, prolonged use, non-medical use without supervision, and misuse can lead to several problems and opioid dependence. I mean, even taking them as prescribed can do that as well. Research has shown that about 500,000 deaths all over the world are attributed to opioid use yearly. Shockingly, over 70% of those deaths are related to opioids that are used for musculoskeletal pain. Essentially, the people are trying to get out of pain, and about 70% of that pain is back and neck pain. Do you think there's anything else they probably could have done? And as a matter of fact, there are, and we're going to cover that on future podcasts. Now, the truth is what makes opioid medications effective for pain management can also make them dangerous. Now, what are the side effects? Well, the use of opioids has been found to cause a wide range of side effects, everything from lowering your heart rate and your blood pressure, causing slower breathing, and then some of them even affect your ability to drive. Common side effects are things like nausea, drowsiness, constipation, vomiting, thought and memory problems. And I think one of the biggest problems is dependence and then also tolerance, because apart from the side effects, taking opioids can cause people to become dependent on them. And you tend to have withdrawal symptoms if you stop using them. And then that's going to look like insomnia, muscle and bone pain, vomiting, restlessness, chills, goosebumps. And then dependence is often associated with tolerance, which is the need to take more and more at higher doses for the same effect. And research has already estimated that about 36 million people worldwide abuse opioids. And the thing is, when they can't get opioids anymore, then they turn to those things that will give them this essentially the same effect, like heroin. Now, higher doses often cause more dangerous side effects, and as the patient becomes more and more dependent on the opioids, the number of deaths increase. There are states that are putting measures to regulate how doctors prescribe opiates. Addicted patients still look for ways to obtain these drugs. And what it ends up doing is people who are really looking to get some help that don't want to take these things are often looked down upon because they are in pain, they're trying to get help, and then they're looked at like they're some sort of drug abuser, even though they've never even take these things, and they get accused of trying to they're just telling people that they're in pain to do that. And I hear that time and time again from my ER nurses, ER doctors that I take care of. And the sad thing is dependence on opioids it's heartbreaking. And the good news is that, it really is preventable in most cases. Because there are a lot of holistic measures such as chiropractic care that focuses, part of the care on, pain management through a very safe and a very non-drug approach, because the chiropractic adjustments in combination with some lifestyle factors really do help free up the nervous system and the body to function the way it was designed to do. But part of the side effects of that is it does relieve some pain, even from surgery, injury, arthritis, and even many other conditions. So we're going to cover more of that on the next two podcasts. We're going to talk about some different supplements and foods that are really great for pain relief, but we're going to be talking about some other effective measures that you can do instead of opioids, or as an alternative to, or even as a way to get off of them. So again, this is Dr. Jason Jones signing out. We'll see you guys on the next podcast. See you later. Bye-bye.